Good morning, my fellow Nigerian. Good morning, most especially the vulnerable group in Nigeria, the marginalized, the disadvantaged. Good morning, because this message and this information are for you, and we are trying our possible best to see that we enlighten you to the point that you'll be able to at least enjoy some rights you have as a citizen of Nigeria, especially when it comes to your issue of health in Nigeria. We all know how deteriorated the health sector is in Nigeria today. Not only health sector, judiciary and all of that, everywhere, everything in Nigeria is in shambles. But at our own little way, we at least equip ourselves, create awareness in our minds to know what is right and what is wrong. At least if everyone at their own little level, we recognize the right thing and put it into practice gradually. They says that better to be late than never. At least one day, if not in our generation, the generation to come will at least have a milestone in reduction of the suffering we find ourselves today. Today, like I've promised you from my previous video, I'm going to talk about the National Health Act, 31st October 2014. I'm very sure that many people don't know that this act is existing, and even those that are aware of it don't know how to apply it to their life and their situation. At least I'm going to be a kind of brief you on what this act is all about. The National Health Act, as earlier said, you understand, the act is a framework for the regulation, development, and management of national health system and standard for rendering health services in the federation. Is for regulation, is for development, and it's for management. And it gives a framework, a standard, how the health system should be run and how the health services should be rendered to individual, to a citizen in Nigeria. You understand? So this is just the definition of this act. Then, in that act, it is stated that a healthcare provider, health worker, or a health establishment shall not refuse a person emergency medical treatment for any reason. It stated that any medical personnel or health worker or any institution of both private and the government by no reason rejects a person that is in emergency condition. You understand? No matter the situation, no matter what caused that problem, it is obligation of the health professional to attend to that person's emergency. That is one of the points in this session. And to follow that, in section 21 of National Health Act, it stated that a person who contravenes this section commits an offense and liable on conviction to a fine of 100,000 naira or to imprisonment for a period of not exceeding 6 months or to the both. You understand? Even though the money mention for the fine is very poor. At least it's a discipline. At least if they are convicted for something, that shows a loophole in your practice. That means there is a problem. At least you have ethical and moral problem for being convicted for issues that shouldn't be. So anybody that refuses to attend to a patient or render services to a patient in emergency contravene this, and the fine is 100,000 or being in prison for 6 months or the both. That is the punishment. You understand? Then we are saying this because there are so many people that feel that the hospital only do them favor and they have no choice. You understand? They have no choice. We have the National Arts Policy. And in that policy, the A part of it says, a right to the highest attainable level of health is fundamental right of every Nigerian. A right to a highest obtainable level of health is a right, not a privilege, a right of every Nigerian, including access to timely, acceptable, and affordable health care of the highest quality and international best practice. So in your case, you go to hospital and they are managing you, do anything they want to do, they just managing you, the standard is not maintained. It's against the policy of National Health Act. You understand? But what you do not know is above you. That is why I advise in one of my things that it's good you have a health professional in your family, if possible. So that some of these things we are saying will make sense to you. When you need to a kind of seek for redress, it will be easy for you to do that. You understand? So now, it is a right for every Nigerian to receive the highest quality of health services of the global best practice. That is what the art policy says. You understand? That is what it said. And this is what is obtainable. So, having looked at this, what is the patient's right in the hospital? I mentioned that in the previous slide. What is your right? Number one, as a patient, you have a right to be treated with respect, regardless of your gender, age, race, religions, ethnicity, allegation of crime. That is one of the points. Disability or economic circumstances. Allegation of crime, yes. You have been alleged that this, you commit this, you do that, you do that. That is not stopping the health professional from attending to you. It is only courts, a competent court of jurisdiction, that will decide whether you are guilty or not. So, at the level you were brought to the hospital management or the personnel have no right to reject treating you. So, it is your right as a citizen in Nigeria to receive a timely treatment from that hospital. And you should know that. Disability, your economic circumstances should not be used as a parameter to treat you. Secondly, under the right of the patients in a hospital, right to receive urgent, immediate, and sufficient intervention and care in the event of an emergency. You have emergency, you have emergency, and the doctor will say until this happen, before this happen. No. You have a right. It's a right. Listing between right and privilege. Your right is your right. Privilege can be waived. Privilege, the person may decide, okay, you are no longer eligible for that privilege. But the right, until court do otherwise, you have that right. It's your birthright. You have it. So now, in this part now, the right to receive urgent, immediate, and sufficient intervention and care in the event of emergency. All right? So now, you have to bear this in mind. That is your right as a patient. That is what you know. So in case you are in the hospital and you are in emergency, or your beloved one is in emergency, and a doctor, a kind of a dragging feet to attend to the person for whatever reason he mentioned, and anything happened to that person, you will now sue the hospital management for medical negligence. Yes, you heard me well. You will now sue the hospital for redress for medical negligence. And you may ask, how could that be? How can I do that? I'm not a doctor. Fine. That is where we come in. You are a lay person, we know very well. You are not a medical personnel, we know very well. You are vulnerable because you need somebody assistant to survive, we know very well. That is why this information is very, very important to you. I am not giving out this information to a billionaire, millionaires, those that are capable to fly their people outside the country for medical attentions. I'm saying this because of that poor person in that community that's been mishandled. That person in that place that is struggling to receive medical attention. Each time comes, they dump him, they throw him as a garbage. That is the essence of this, because that is what we stand for. You get it? Now, what and how do I establish medical negligence against a professional or a establishment? How will I do that? There are key things, key factors to be looked out for before this can be done successfully. Before you take any step of redress, before you take any action against any professional, there are things, three key things you are looking out to be established. And the first and foremost is very, very important. Though we neglect it in our visiting to a clinic or a health center, the first thing, pay attention very well. Whenever you get to a hospital, the first thing they will ask you is to get the hospital card, the folder. Yes, to you, you are paying 1,000, you are paying 500, you are paying 5,000, and it's a big deal to you because you don't have. But that is your first legal tools to seek for redress if anything goes wrong. That is a contract being signed between you and that establishment. And you can't take that lightly. The first thing first is to obtain the hospital card, whatever amount, get it before your person's being attended to. Yes, you get this card, whatever amount, they put your name in their hospital book and they give you a small card. Is an evidence that you have established a contract with that hospital. Is a clear fact. You have established a contract with that hospital. Then, watch out for the time you take your person to that hospital. That's number one. That is the number one thing you need to look out for. Then number two, the breach of duty of care by a provider. Yes, my patient was brought to the hospital in so time. Nothing has been done from this time to this time and this time to this time. And in a normal global best practice, this should have been done, this should have been done. That will be decided in the hospital by other professionals. So the breach of that duty of care is the second thing. Be sure that the negligence, the doctor in question, neglects your persons, or you don't give it sufficient attention that expected to be given for that condition. In medical practice, time is very, very important. Time is very, very important. You can't take away time from medical practice, because everything about life, when it comes to emergency, time is very, very important. So you check how they manage the time they give the drugs. Do they come to the patients when expected to come to him? Do they give injection or tablet? What do they do? And whatever, nurse, whatever they do, being at alert and record, take note of them. Then, the last thing, which is the third, is the damage suffered as a result of this breach. What is the damage that this costs? Is it that the health of your person is deteriorating? Is it that it costs the person his life? The person is dead from this negligence, from this breach of contracts? These are the tricky. And if it is well established, you go for redress, and the case is clear. You go for redress. Why am I doing this? Why am I saying this? So that the level and the extent of people losing their life and beloved one as a result of negligence and medical negligence should be reduced. Yes, it has to be reduced. You go to school as a professional, ethics of professional, your whatever you learn to do your management, your passions and feelings for the patients is no longer there. You are now on your own. You practice as you like. You make sure that just what you want is the money. What comes to your mind is the money. You don't even do research anymore to help life. What you do is how much you will get from that poor person. That is my problem. And that is my organization problem. My foundation problem. And we cannot fold our hands. We continue to enlighten the poor masses until they come to the knowledge of what should be done to them in the hospital. Like I've earlier mentioned, in this case, if the damage depends on the damage, they may decide to withdraw the certificate or the license of that practitioner. They may decide to imprison him. They may decide to ask him to pay fine for damage. You understand? We all know that there's no any amount of money that will bring or will be a kind of compared to your beloved one, you lost his life, but at least some amount will reduce the burden on the family. Yes, because if that person is there, his presence will cover some things in that family. So if he's not there, at least the compensation for that damage will be able to help the family, the children, the wife, and some other person in that family. So that is the essence of this. So the art is that you don't go to hospital and the nurse think they are doing you favor. You understand? I'm not saying this for you to go and be fighting professional, fighting nurse and whatever. No. In a polite way, let them know, draw their attention to know that you are aware of the consequences of anything they are doing. You understand? Our problem is that nobody is ready to take any step. You check your time spent and everything. You just decide, let me let it go. Yes, I'm going to tell you, because of our time, I'm going to tell you about some incident that happened that would have caused some hospital, a government hospital for that matter, if not for the intervention of some of our traditional personalities. Not everybody that die in the hospital die because of ailments. Not everybody that die in the hospital die because their time is off. Not everybody that die in the hospital die because their conditions is untreatable. No, 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 no. Most of them in our present Nigerian medical system or health system is as a result of medical negligence. And nobody is asking any question because we are subjected to this point. Nobody is asking why this happened. So, welfare of the African Vulnerable and Egalitarian Foundation is a household foundation that have taken it upon herself to help the poor and the vulnerable that cannot help themselves. This video, like I've said, is a series. You must get all the message, you follow it batch by batch. Because I'm going to continue in another one. I don't want to make a lengthy video that will make you bored when listening to it. At least you'll be able to, after the first one, you have more desire to listen to the next one. The next one is a continuation of what we are saying, but I don't want to bore you with a lengthy video. I want to talk about how we can come in, how we can help you, how you can get a redress for free. Yes, for free. You heard me well. So only thing you have to do is just whenever you come across our video, turn on the notification button. When you get an update from us, share it, like it. Like I've told you from the beginning, we don't need your money. No, I'm not doing this for money. All I need is you to be healthy. And your own part you can play just to like us so that Facebook and other social media will recommend us to more people. Let this information get to the grassroots. Let this information get to people. When everybody is aware of this, if you ignore it, it may happen to you and your family, and that will be late. Nothing anybody can do because the information is not there. So share it to your family member, share it to your group so that it go rounds and this information will go down. You understand? When you are equipped with information, you have power to redress so many things that is going wrong. But when you are limited, the information at your disposal is limited. Your ability to change issues, to change things around you is also limited. So that is the only thing I want you to do for us. Just like, share it, and comment. Then we will do the talk and we'll tell you what to do next. Thank you very much for being here for us. And we assure you that at the end of this, you will have every cause to say, thank God I come in contact with welfare of the African Vulnerable and Egalitarian Foundation.